Aloha and welcome to your ALS Connection, the ALS Association Golden West Chapter show dedicated to bringing you the most current, interesting, and cutting-edge information surrounding the disease of myotrophic lateral sclerosis, otherwise known as ALS. My name's Kahala Hauser. I'm your host. I'm the Director of Community Outreach and Signature Events with the Golden West Chapter. We're excited to be bringing you the first in the series exploring all sides of ALS, including how the ALS Association is making it possible to better identify and help those who have been diagnosed with this disease. We will be discussing progress made in the world of science to find treatments and a cure, and how the Golden West Chapter can improve the lives of people living with ALS in Hawaii. I'm very excited about today's show. We have four very special guests who are here to help us launch our first show, including the President and CEO of the ALS Association Golden West Chapter, Mr. Fred Fisher. Welcome, Fred.
Hi, Kahala.
Glad to have you here.
I'm really glad to be here.
Let's get started. Tell us about ALS. What is ALS?
Well, ALS is a brain disorder. The motor neurons in the brain and spinal cord die, and as a result, people lose the ability to use their muscles. It affects, excuse me, it affects the ability to speak, to swallow, to move, and eventually to breathe.
How does that affect the people here in Hawaii?
Well, it's a very difficult disease to manage. I'll have some of that now because otherwise I'll choke. Thank you. It's a very difficult disease to manage. As ALS progresses, people typically lose their muscle function, and this can take place over a period of 2 to 5 years. And so ALS moves pretty quickly. And so our job as the ALS Association is to help people manage the progression of the symptoms as they reveal themselves. One of the challenges around ALS is that it can start in your feet, it can start in your hands, it can start with difficulty swallowing or slurring of speech or trouble breathing. Regardless of how it starts, it tends to move throughout the body, affecting basically all of the muscles except for your heart.
Last year we had the ALS Ice Bucket Challenge. That proved to be something very valuable, and it brought attention and awareness to the disease itself. Can you tell us how that affected?
The ALS Ice Bucket Challenge was an unprecedented phenomenon, both from the point of view of awareness as well as fundraising. And that money is now powering research all around the world. More than 100 research projects in 12 countries are looking at all aspects of ALS, and most importantly, urging and urgently seeking an effective treatment and cure. You know, a lot of people don't know that ALS as a disease, some people think of it or know it as Lou Gehrig's disease. There's really no effective treatment, just one drug approved by the FDA that slows progression of the disease about 2 to 4 months. That's not very much. And so Ice Bucket Challenge money is powering significantly more research that is bringing us closer to one day having that drug. In the meantime, clinical research shows that the best way to help people live better and longer with ALS is to provide them with multidisciplinary care. It takes 9 different doctors to treat a person with ALS, and none of us are able to manage appointments with 9 different doctors, going here, going there, all those scheduling. A healthy person can't do that, let alone a person suffering from ALS. And so our model of care is to bring all of those professions, neurology, gastroenterology, respiratory therapy, speech therapy, occupational therapy, physical therapy, social work, mental health services, nutrition services, all of those things that are required to help a person live longer and better with ALS. And research shows when you do that, you actually help people to live 3, 4, 5 times longer than the only FDA-approved drug. So that's why the ALS Association is so committed to finding a cure, but equally committed to helping people live with the disease.
Absolutely, wonderful. What progress have you seen that's been made here in Hawaii through the Ice Bucket Challenge?
Well, what the Ice Bucket Challenge is bringing to Hawaii is an unprecedented level of service and support. As a result of Ice Bucket Challenge dollars, we're now able to have a full-time care manager, someone who travels to all of the islands, visiting with every single person living with ALS, meeting with them in their homes, helping them not just manage their current state, but help them predict the future trajectory of the disease so that they can be prepared and that we can avoid a crisis. We can avoid emergency room visits by helping people plan for what's coming next and giving them the resources they need, the equipment they need, all the tools they need to live with ALS. The ALS Association's mission is centered on helping people live life to the fullest with this disease. And so our care manager meets with every family affected and gives them the resources and support they need to live well with ALS. We're also looking at bringing a research project to ALS, the first ever research effort in Hawaii specifically focused on ALS. Ice Bucket Challenge money is helping make that possible. And equally as important is you need a place where that research can take place. And so you need the patients, you need the research, and then you need a clinical center to be able to conduct that research. And so we are currently talking with folks about building this multidisciplinary clinic that will be a site for people to get care and also the site for people to participate in clinical research specifically targeting ALS.
That's fantastic. Tell me a little bit about why you came to Hawaii. What generated that? What started the Golden West chapter for being here in Hawaii?
It's a really great question. In our experience, people were coming from Hawaii to California because everything I've described is available right now in California. The Golden West chapter is actively involved in supporting 15 of these clinics and lots of clinical research going on in California. So people who want access to state-of-the-art care, they had to go to California to get it. And families that lived in California suffering with ALS, deciding to move home to be with family, ended up cutting themselves off from the resources that were helping them live with the disease. And so those families reached out to us and said, we'd like to have care right here in Hawaii. We don't have to want to leave Hawaii. And so the Walk to Defeat ALS started it all and helped us raise the money that made it possible for us to begin services. We've had 3 walks now over the last couple of years, along with the Ice Bucket Challenge. That's making it possible to fund the service and really build a program here in Hawaii.
Fantastic. I've noticed in dealing with the families here, we have a sense of ohana and reaching out to one another. Can you tell me a little bit about the support groups that are going on here in the state?
We have support groups on every island. So no matter where someone lives in the state, we can get them support. Support with other people, support through our care manager, support through our community outreach. So no one should be alone living with ALS.
Fantastic. Thank you, Fred. Enjoy the rest of your visit here.
Thank you.
ALS can strike anyone at any time, and it's only together that we will defeat it. Please take a look.
I am the ALS Nation.
I am the ALS Nation.
I'm the ALS Nation.
We are the ALS Nation.
We've been called orphans, but that's what makes us stronger.
That's what makes us fight harder.
And that's what makes us want it more.
We can't give up.
We won't give up.
We will never give up.
We are determined to conquer ALS.
We're committed to conquering ALS.
We've lost too many people to this disease.
Wonderful people.
My wife, Catherine.
My father. My partner, Javier.
My husband, Tom.
ALS has won too many times.
Now is the time for us to band together.
Now is the time to work with one purpose.
and with one goal.
Now is the time for us to be unified.
We need a cure.
A cure.
A cure.
A cure.
If not a cure for my generation, then when?
It's time for a cure, and with your support, we can do it.
Together, we can do it.
Together.
Together.
Together, we can do it.
It is only together that we will defeat ALS.
Help us make history.
Join the ALS Nation.
And together we will defeat ALS.
Our next guest joins us from the National Office of the ALS Association in Washington, D.C. We are glad to welcome our Chief Mission Strategy and Public Policy Officer, Steve Gibson. Thank you. Welcome. Glad you're here. Tell us a little bit about what you do.
Sure. We have a public policy office department in Washington. 18 years ago, before I was hired, people with ALS didn't have a unified voice in Washington. I created a system that allowed patients and families to speak with one voice to advocate for more research dollars, for a treatment and eventually a cure, and for more services for people with ALS.
Fantastic. Now, how did you do that?
Well, we got together by having some priorities. We were able to actually achieve some remarkable things for people with ALS. First was a Medicare waiver that actually cut 24 months from a person having to wait for their Medicare. And as you know, 2 years in the life of a person with ALS is a lifetime. We were having people, family members, who actually were receiving their patient's first check after the loved one had passed. So we were able to change that. Congress passed a law in 2000, and we're happy to say that it's the only time Congress has amended that law, and it's for people with ALS. We also worked with the VA, the Veterans Administration, to have ALS as a service-connected disease. So no matter when you've served your country, if you're diagnosed with ALS, you're able to get extra benefits. And actually, there's a lot of people that don't know about this. And before the law was passed in 2008, so I asked that they reach out to the Golden West chapter, to you and to Taryn, to find out about these benefits, because there are survivor benefits that can really assist someone who's lost their loved one maybe 10 or 15 years ago, because this waiver, this benefit actually goes prior to World War II.
Fantastic.
We also create a powerful research engine called an ALS Registry that begins to answer the question that many patients have of why me. You know, I'm sure you've heard about the high incidence of soccer players in Milan who have ALS, the football players in the NFL who have ALS. We have a study that shows that if you smoke, you're more likely to get ALS. If you drink, you're less likely. But unfortunately, all these studies are so small, we don't know enough about them to say, are these risk factors or not?
So what is that, the registry?
That is the registry. And the registry works, it's composed of first mining government databases. So if you are in Medicare, in Medicaid, in the VA, we have 80 to 85% of people with ALS in those databases that we know about. For the people that aren't in those systems, we need people to enroll through a portal that is at cdc.gov/ALS to be able to come in there and to enroll in that registry. Even people that are part of that government database, we need them to go there and also enter and enroll, because there's about 18 questions that we ask to make sure and see what people's exposures, what people's experience have been, to be able to talk about some of those risk factors we mentioned. One of the things that CDC is going to be doing this fall is to create a biorepository. That's a national biorepository that we've never had before, that actually will be able to look at the complete picture of someone with ALS to say, oh, this is someone's tissue, someone's skin, someone's nails, and let's see what their past experience have been. And this is going to be really wonderful for researchers to look at that whole picture. It's also going to really kind of change how we collect these things, because right now, if you are living in a place like Hawaii, you're not around where the biorepositories are set up. Here, medical professionals will come out to you and be able to get samples to contribute to this biorepository. And last but not least, the ALS Registry is changing the paradigm on clinical trials. Many people who try to get into a clinical trial go to clinicaltrials.gov, and they really have a terrible experience. They can't find a trial they qualify for. And so by enrolling in the registry, by checking a box, if you qualify for a trial, the information will come to you, and you'll have the opportunity to say yes or no, you want to participate in that trial. And it really has changed the paradigm for clinical trials, because researchers who are waiting weeks and months to get trials enrolled are now just waiting days. And so we hope that will continue. Many large companies have begun to use that, and this will help bring the clinical trial to the patient.
Fantastic. In Hawaii, do we see a lot of people registering?
Actually, why we're here is Hawaii is one of the under-enrolled states, so we need more awareness about it. We are at a conference here to talk to more medical professionals about the ALS registry, to get more neurologists and technicians and healthcare professionals to understand the importance of this registry. Because, as you know, many people with ALS have that question on why me. And going back to those survey questions, we actually are excited to share that one of the questions is open-ended. So when we meet people with ALS, many of them actually have an idea on how they came down with this disease. And by having this open-ended question, they'll be able to put what that defining moment was. Was it a car accident? Was it some exposure? Was it a certain drug that they were starting to take for another condition? And that will now allow people to do that.
So they can start to do the comparisons, and they can associate the disease for the different people.
Researchers throughout the country will be able to look at the entire picture and look at patients in every 50 states. It is a nationwide registry, and it's the first nationwide registry ever created for ALS.
It sounds like a big undertaking to have this registry.
It is, and we just have to get the word out more to talk about that, because it is the largest research project ever created, with the amount of people that are enrolled in it. Mm-hmm. And we want more people to take advantage of it, because we've been advocating for many years for it.
Is there anything else that you'd like to tell us? Is there anything about this program that you're doing? Is there anything up and coming that you'd like us to know about?
I think, as I said, cdc.gov/ALS is the website for people to go to learn more about it. Even if you are a caregiver or a spouse, you're able to look at it and see some of the research projects. The registry actually funds research projects, and so you can see really kind of the breadth of what's happening out there. And of course, we always hope that people will sign up to be an ALS advocate at our website at alsa.org.
Fantastic. Thank you so much. We're glad you're here today and sharing this information with us, and we'd like to make sure that everybody gets signed up.
Absolutely. Thank you.
Thank you. Enjoy the rest of your vacation here.
Thanks.
Living with ALS requires a positive outlook, a strong spirit. No one exemplifies that more than Scott Liu, as you see in the next film clip.
They asked me to write the commercial to tell you what it's like to be me. I have ALS. It's a disease that has taken away my ability to move or talk. Just getting out of bed in the morning is a huge effort.
I think when you're someone like Scott, you've had 20 years behind you of ritual, of writing. This is something that his brain is sort of wired to do.
Despite not being able to move or talk, with help, I can still be creative. My mind is fine.
An ALS patient has a choice to make, probably pretty early on in their disease, if you will use a ventilator to help you breathe. I think the choice to go on a ventilator was Scott's for himself first, because he really just doesn't feel finished in this life. And then when his children came, it was reinforced for him.
I can still be a husband and a father. I know you can't see it, but I'm smiling. And because of them, I wake up every morning with everything to live for.
Awesome! It's only together that we will defeat ALS. Find out more at alsagoldenwest.org.
Scott Liu is an inspiration to us all. A big part of his life and why he continues to be vital is his wife, Anne, who serves as his primary caregiver. November is National Caregiver Month. during this month, it was designated by then President Clinton. And every year since then, we've used this month as a National Caregiver Month. We're fortunate to have with us today Sandy Repczynski, who's been living with ALS since 2013, and Taryn Davis, the Golden West Chapter Regional Care Manager in Hawaii. Welcome, and thank you both for being here.
Thanks,
Pleasure.
Kaka. Thank you.
John, you were diagnosed in 2013. Up until then, you had a fantastic career in the entertainment industry. Will you tell us a little about that?
I don't know how fantastic, but yeah, I worked in television for 45 years. And actually, September of 2013, I was one of the close-up cameras on the Emmys. And right after that, I was diagnosed. Even during that show, I was having my arm shake a little, so I knew it was time. But yeah, I've worked in public television, I've worked sports, I've been a director. I retired off of The Voice. I did American Idol, I did the Oscars, the Emmys, the Grammys, and now I'm a patient of ALS.
That's, well, we're happy to have you here today. And
Thanks.
for those of you that don't know, John is actually helping us behind the scenes producing this as well. What changes did this diagnosis bring to your life?
It's pretty major. I mean, the things that you take for granted go away in a hurry. And in my case, it started with my hands. And that's why I wear a brace, because this wrist is pretty well gone. If I didn't have the brace, that wrist would be like this. And I'd say it's like, say you're used to doing a certain thing, like buttoning a shirt, and now someone says, great, now do it with oven mitts. And you find a way to do it with the oven mitts, and as soon as you do that, somebody says, great, here's some boxing gloves. It changes that fast, and you really don't know when it's going to change or how it's going to change, and the changes are drastic. I need to have help getting dressed. I need to have help eating. I can't cut my own food. So, and that's in 2 years.
2 years. What other, you've gone into it a little bit, what other type of special care do you need?
Oh, right now, my wife is pretty much my caregiver, and it's going to be awfully difficult for her because she has to drive, she has to help me bathe, she has to help me get dressed, help me eat, and I really can't be alone for a really long period of time. Sure, for a day I'm fine, but if we were to travel somewhere, I couldn't travel alone. And as you can hear by my voice, you know, when that goes, it's going to be tough. And like I said, you never know when these things are going to go. Mm-hmm. So the care is going to be intensified. If it weren't for Taryn especially, the local people with the ALS Association have been fantastic. There's seminars on mobility, on speech, on food, on nutrition, on you name it. And they're pretty much preparing me for what's coming up. And after that, I do have long-term care insurance, but it's still awfully, awfully hard on any caregiver, awfully hard. And as much as you love somebody, try working for two your whole life. It gets very strenuous. You know, you don't have downtime.
Mm-hmm. Well, thank you for sharing that.
Sure.
Taryn, like I was saying earlier, in 1997, in the month of November was established as the National Family Caregiver Month by then President Clinton. Why is this topic so important?
I think back then they finally realized the impact that having to be a caregiver affects the community and even the nation. When somebody comes down with ALS, they often are a primary income resource, and that's going to be gone in the family. Mm-hmm. And then after that, usually it's the spouse who's the caregiver, and they have to cut back on their hours to help be the caregiver. And so financially, it's a huge problem. And for the family, but also taxes are gone there and everything. So I think that's why they recognized it to be such an issue for our country.
Thank you for sharing that. What are some of the unique challenges facing the caregiver people with ALS and their families living here in Hawaii?
There's so many. The first one, which I have to warn you about, is your electricity bill goes up really a lot. $200, $300 when you're on a non-invasive ventilator or a BiPAP. And that's a big chunk of money out of an income, out of a family who's already hurting. So that's something that people have to deal with. And the second thing that I'm thinking of right at the moment is injury. Caregivers often hurt their backs or their shoulders because they're the only ones that are there available or that they can afford is family members. And without proper training and techniques, many people get injured. And plus the stress of being a caregiver often affects the health too. So there's a lot, that's just 2 out of many.
Are there resources here in Hawaii? Is there people that come out into the home and help?
We have Dana Project that I know about that comes and goes depending on funding. There are companies out there that you can hire, and a lot of people can't afford that. In Kauai, we have Share the Care with Deborah Duda, and that's a fantastic program that we'd love to see in the other islands as well. But doesn't take care of everything. We're trying to teach the families to do Share the Care on their own, where they can pull in their family members, church members, community to come and sign up for different duties to help lessen the burden for the family members.
Well, thank you for sharing this information. I think it is an eye-opener for a lot of people when they realize the amount of time that's spent and the families coming together and the neighbors coming together as a community to help. Thank you for sharing this with us.
Sure.
I want to thank you for spending time with us as well. We call the show the ALS Connection because we want to hear from you. So please send us your thoughts about the show or additional ALS topics we'd like to see in the future. Remember, it's only together that we will defeat ALS. Aloha.